Hello everyone. Uh, Good evening everyone. Uh, I am Dr. Shaurya here, and now we are going to start your interactive session regarding how was your paper and all. First of all, we will be discussing about the pattern of this paper and how to deal with this kind of paper. Okay, and how was the paper and other topics we will be discussing. So, should we start? Okay, so I think we should start now. Dr. Jatin Purvia, yes, the paper level was actually, see, moderate to easy you can call, okay? The paper one was mostly one-liners and Dr. Jatin, okay? And PYTs were mostly repeated. Previously asked questions and topics, they were mostly repeated. So that's a good thing of this topic. And on the online sessions which we conducted on YouTube and before that in the app and offline sessions in the classes that we conducted, there were a lot of questions repeated from the previously asked topics. And the revision sessions especially were very helpful as reported by our students of our offline batch and some students of our online batch, as well as the students of our YouTube and Telegram channel. A lot of students informed us that yes, there were a lot of repeated topics. So if you would have revised, the first paper was easy. So regarding second paper, yes, surgery, it was a little bit out of the trend because they asked some questions regarding flaps and all, but nothing to be worried because see, in these kind of exams or any exam, some subjects, if they ask you moderate to easy questions and repeated questions, then in some other subjects they will try to increase the difficulty level. So it is uh, an obvious pattern, you can say. So regarding clinical subjects, you need to clear your subjects and concepts in a much proper manner regarding study. So now we will be discussing here a little bit of type of questions, and before discussing that, our main aim is to discuss about the roadmap for the next December exam. That means how to study. Okay, because this is a starting time, and I think we should prepare in a much better way and better manner, that how to study and how to prepare ourselves for the upcoming exam. This is for the freshers who will be attempting this exam in the first attempt, and also for the repeaters, okay, who are feeling like yes, this July attempt, after viewing the recall sessions or after attempting the exams, the repeaters who are feeling like yes, I will not be able to fare very well in the exams. So for them also, this session is very important because uh, irrespective of your preparations, if you did not fare well in your exams, then yes, you need to start planning ahead for your December sessions. So for that, this session will be, I think, boon for those kind of students. So let's discuss. We have some people online. So anybody having any concern, please. And some questions we will be doing. So regarding pattern of study, how to start studying, I'll tell you a few things, guys. First of all, try to complete the subjects within, we have because right now we are in the month of July. So I'll tell you this, that first try to complete subjects within first round, try to do in 3 to 4 months. Actually, those for those who are repeaters, you have notes and everything, okay? So you just have to finish your main notes and everything and revision from whatever source you have done. And for freshers also, for within 4 to 5 months you should just finish first round of syllabus. ठीक है? Regarding second round, what should you guys do? For after then you should start revising for the second round. And while you are doing your first round of the study, don't forget to solve questions, MCQs. ठीक है? And major stress should be on PYQs and not to be very specific, not on the PYQ but PYTs, previously asked topics. Because see, every year they do not repeat the same question, the same options. They slightly twist the questions and options, and this is obviously they will do. But what they repeat is the PYTs, previously asked topics. Common topics are repeated every time. See, in PSM you might be seeing that about waste management, biomedical waste management, that topic is every time repeated. Regarding primary prevention, primordial prevention, secondary prevention, that thing, every time they have questions from those kind of topics. ठीक है? Now coming to treatment of malaria and leishmaniasis, ठीक है, कालाजार, ठीक है, regarding these treatments you must know. Regarding leprosy also you should know. Common diseases, common treatments you must be knowing. ठीक है? Drugs contraindicated in pregnancy, they ask question every time. ठीक है? Antihypertensives you must study. And in ECG common topics, arrhythmias, ठीक है, MI, anterior wall, inferior wall, you must study, because this time also question was there from that topic, and every time they repeat this kind of topics. So I think somebody is asking why are your lips so pink. No, they are naturally pink. Medico Hub, it's not any kind of lip balm or anything. See, my lips are actually they are dry and chipped right now, but they're naturally pink, bro. Maybe due to lighting setup it appears a little bit more pink or something like that, but Leo gaming, it's not pink, it's red. Maybe it appears like that, yes, but it's naturally pink. So, and I don't use any filter or anything. I'm just now sitting in a studio and we are recording. So guys, tell me, apart from these things, how was your paper and how was your experience? If you guys are online, please can you share and can you type your experience? I'm looking at the chat. So we were discussing about important topics, and regarding surgery also important topics we have to study. The questions they've commonly asked from trauma, ठीक है? They ask you question from burns, and trauma is a very hit topic. Now in unit GIT very important, ठीक है? Topics like alasia, cardia, ठीक है? And diffuse esophageal spasm, these kind of topics, they are important, ठीक है? Gastric carcinoma and all. So because they are frequently asked or repeated topics, you have to go from them. Peptic ulcer disease, PUD, you need to know, because these are very important topics as well. ठीक है? In medicine, we know in cardiology they can ask about cardiac tamponade, Bextride, all these topics we revised. And regarding in microbiology also some slides. This time question was from ticks. We revised all those image-based questions, and they asked question from ticks. And slowly, while we will be recalling the subjects, and when we will be recalling, we will be going through them. Medico Hub, you are writing that messed up second part. Yes, second part was a little bit, I agree, for people, most of them were reporting that second part was a little bit tough, mostly because of surgery. But yes, other subjects were nearly not very easy, but yes, doable, we will call, ठीक है? So mild to moderate was the paper level, and we hope that you guys clear, because in first part a lot of questions were repeated. So your score will be compensated in first part, even if you lose a little bit of marks in the second part. So I hope so that an easy target of 150 can be achieved by most of our students. And this was a satisfactory review given by our other offline class students also, that yes, it can be done, and we are hopeful, fingers crossed, that most of them get the desired result. And regarding online classes also, we are hopeful that yes, we will get the desired result. Regarding you guys, so chalo, today matlab not stressing a lot. Abhi exam, just you have finished your exam. I know you guys are relaxing, so you relax. We will just in a little bit in short manner try to recall a few subjects. We will start by shorter subjects only today. चलो थोड़ा सा ऑर्थो कर लेते हैं. Fine, some orthopedics questions we will be dealing with, or we will just see, we will deal the questions and we will try to deal with other subject questions also. So no need to worry. धीरे धीरे little stress give करते हुए we will start. Fine. So chalo, tell me this. 50-year-old female complains of bone pain for several months. The X-ray is shown below. Identify the condition. ठीक है, whether it is osteosarcoma, osteochondroma, Paget disease, or Ewing sarcoma. Look at the X-ray and tell, please. So what did you guys take in this? Can you guys please tell me? See, today we have a very less time limitation, so we'll try to make it interactive. Those who are online, please try to answer. This is the manner generally we teach. I know most of you are in relaxing mood after the exam, so they are very few years. But yes, Dr. Muskan, hello. Leo gaming brain के घोड़े लगे. I understand. But now you guys should relax. Exam तो खत्म हो गया, and however you fared, you have already done your you are already done with your paper. So now you can't do anything. Your answers are locked with the NB. So and results will come very soon. So no need to get worried. So बताओ what is here apparent in the X-ray. You can see here the cotton wool spots. ठीक है. These are indicative of, tell me, Paget's disease. ठीक है. So the answer here should be Paget's disease. And what is Paget's disease? Can you tell me? It is also called as osteitis deformans. ठीक है. It is a primary disorder of the what is the it is a primary disorder of the osteoclasts. है ना? So we will be moving ahead. Osteoclast. What happens here? ठीक है. There is excessive osteoclastic activity that is followed by excessive osteoblastic activity. है ना? So what does osteoclast do? Osteoclast eats up clast काटेगा. Try to remember it like this. ठीक है. So clast eats up the bone and blast is like blast forms new bone. ठीक है. ऐसे. So you have to remember there is excessive osteoclastic activity followed by excessive osteoblastic activity. ठीक है. Now, so you will see you guys must have seen in the Robbins they have given the bone cut section. There's a honeycomb like appearance. ठीक है, in the skull. Now cotton wool spots is also seen. Another important thing is what? Tell me. There's overhanging you can see in the sometimes in the patches of the skull frontal portion of the skull. ठीक है, called as tam or shanter appearance. ठीक है. चलो, we discussed in brief about the patch disease also. So chalo, moving ahead to the next. Can you guys tell me this one? What is this? A 17-year-old presents with growth behind the heel of the talus as shown in the image. Identify the condition. So tell me. See here behind the talus you can see the growth. So what you will call it? Tell me guys. See, this is what is it? This is, tell me, osteochondroma. ठीक है. What is osteochondroma? Tell me. Osteochondroma is also called as exostosis. ठीक है. Exostosis क्या है? It's just like the extra outward growth. ठीक है. You can see here. हाँ. Now, what happens? Is it a common site for exostosis or osteochondroma? So no. Generally, this time they give you a very rare site. This is a rare site. Where is the common site for osteochondroma? Can you guys tell? It is around the knees. ठीक है. Yes, exostosis, extra bone. Yes. Now, see, there is also criteria for malignancy. If there are one or two limited number of exostosis, there is condition that it can be benign. But if there are more than If a multiple exostosis seen, then there is a risk of malignancy increases. Fine. Along with it, we also look for the presence of cartilage cap. Okay. And this is the cartilage cap is not visible in X-ray, but it is visible in MRI. And what is it useful in? It is useful in determining whether the risk of malignancy is more or less. Okay, done. This is extra knee growth, but classical and the important thing what you have to remember regarding osteochondroma osteosis is common site is around the knee. This time they asked you rear side, but you can just see, notice this is an outward growth and extra growth of the bone. So moving ahead to the next question. Chalo. Now, Codman's triangle is seen in which of the following conditions? Tell me: osteomyelitis, aneurysmal bone cyst, osteosarcoma, chondrosarcoma. So, tell me, Codman's triangle, where can you see this? Tell me, others please also answer. Saichand Madhugula, you have answered very good, correctly. And please others attempt answering the question. It will be very helpful if you guys attempt answering questions. I have some message. Okay. So yes, it is osteosarcoma में, ठीक है. So what is Codman's triangle? Can you guys tell me? Codman's triangle, what is it? It is just a kind of periosteal reaction, ठीक है. Type of periosteal reaction. And what is periosteal reaction? ठीक है. Codman's triangle is a type of periosteal reaction. Where do you see periosteal reaction? Tell me, guys. See, you can see Codman's triangle. What is it? It is elevation. Actually, first coming to Codman's triangle, what happens? The periosteum is generally elevated. ठीक है, ये like a triangle. ठीक है. Second, what can happen? Tell me. And where can you find other periosteal reactions? Please, you guys answer. You guys are not answering. Here the answer is osteosarcoma. In osteosarcoma, you will get periosteal reaction. Other findings what you can get in osteosarcoma? You can also see sunburst appearance. ठीक है? Sunburst appearance. These two things you can see. ठीक है? In osteogenic sarcoma. याद आया? Now, periosteal, yes. Ewing's, Dr. Saichand Magdula, yes, you are writing Ewing's. It is onion peel-like appearance, है ना? Sunray or sunburst appearance, yes. Dr. Saichand, very good. So, here comes the Codman's triangle. Just look, we have just inserted an image here. The Codman's triangle, aggressive lesions जैसे कि osteosarcoma, Ewing sarcoma, osteomyelitis में भी दिख सकता है. Where all else you can see active aneurysmal bone cyst, giant cell tumor, metastasis, and chondrosarcoma. You can find Codman's triangle in these places. How will you identify Codman's triangle? Here you can see the elevation of the periosteum. ठीक है, triangle shape. Done. चलो, moving ahead to the next topic. Salter-Harris type classification they had asked you. So can you guys tell me where is Salter-Harris type classification generally used? This time they asked you a question about regarding Salter-Harris classification. Generally they asked you about type. This time they asked you about. Okay, the X-ray is missing, but still, just via this question, we will be trying to revise the types of Salter-Harris classification, because people were confused regarding X-ray, what kind of X-ray was given. So we just thought that yes, we should revise Salter-Harris classification. ठीक है, चलो आ जाओ. Now tell me, This is the metaphysis and the epiphysis, the normal one. In type 1 what is happening? लियोगेमिंग जख्म हो गए, नो नो नो, इट्स नॉट जख्म हो गए बोन में, लियोगेमिंग इज नॉट लाइक दैट. ठीक है, बताओ. In type 1 what is happening? There is just the separations. What separation of the what is happening? Metaphysis and the epiphysis. ठीक है. Type 2 what is happening? Epiphysis is separated from the metaphysis. ठीक है. And small fragment of triangular fragment of metaphysis it is carrying away with it. Just see, small triangular fragment of metaphysis it is carrying away with it. In type 2. ठीक है. Now in type 3 what is happening? Tell me. In the here the fracture is in the, tell me, the epiphysis itself, the fracture is extending. ठीक है. It is there the fracture of the growth plate is involved. Now in type 4 what is happening? The fracture is intra-articular and is extending towards the epiphysis, as well a triangular chip of the metaphysis is also involved. This is type 4, you can see here. ठीक. And in type 5 what is happening? The epiphysis and the metaphysis they crush against each other. ठीक है. And growth arrest usually is followed. Why? Because epiphysis is damaged, and epiphysis is the growth plate of the bone, growing bone है ना, long bone में. So if epiphysis is damaged, what will happen? The growth will be ceased. Growth plate is damaged. Now moving on to the next question. A patient who had fall on an outstretched hand. X-ray showed the first metacarpophalangeal joint fracture along with the subluxation. Define the fracture. अब बताओ. So first metacarpal joint, can you tell me what is the first metacarpal joint? Metacarpophalangeal joint. Some people were telling scaphoid, so no, it's not scaphoid. Why it's not a scaphoid? Tell me. Scaphoid is the carpal bone. It is not a metacarpophalangeal joint. ठीक है. It is not a metacarpal. First metacarpal नहीं है. Scaphoid is a carpal. ये sorry, it's a समझ, it's a carpal bone है ना. She looks too pretty, try to catch her. याद है? So in that scaphoid is a carpal bone. तो scaphoid cannot be the answer. लेकिन first metacarpal क्या होगा? In near the thumb. ठीक है. So now confusion comes down to all. You can see here first metacarpal fracture. So now confusion comes down to whether it is Bennett or it is Rolando, because these both of them are the fractures of the first metacarpal. ठीक है. So how will you decide whether it is Bennett or Rolando? Tell me. In Rolando what happens? There are multiple, the fracture is comminuted. There are multiple fractures. ठीक है. Multiple fragments you will find. ठीक है. In Bennett's only 2 fragments only, and it is in Bennett. What is, how is Bennett? Bennett is an oblique fracture. ठीक है. Oblique fracture है and multiple fragments नहीं है in Bennett's. But whereas in Rolando what is happening? There are multiple fragments है ना. So the answer here will be Bennett, because X-ray only 2 fragments was given. Fine. And the fracture was oblique. ध्यान रखना, oblique and 2 fragments Bennett, and multiple comminuted fracture will be Rolando's. ठीक है. First metacarpophalangeal का done. We have revised. It was a very short session. We have revised orthopedics. Now by 10 we will try to revise other subjects if you want. ठीक है. So I think more people have joined. So the questions we have discussed a few of them. Now we will try to discuss some other questions. ठीक है guys. चलो, here we have this. So now guys tell me, discuss pathology MD1. Yes, बिल्कुल 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 Mohammed. We will do, we will discussing, or we will try to discuss all 19 subjects. ठीक है. हाँ, most of them, very few questions were from ortho and some are here and there. So almost over because this short subject है तो questions उतने ही आते हैं. They are only this much limited amount of questions, bro. So we just started with small subjects because we just wanted that कि हाँ you guys should revise a little bit. अब थोड़ा थोड़ा पढ़ने की आदत डालना शुरू कर दो. I know you guys are in relax mode और तो अब धीरे धीरे उसी बहाने regarding discussing the PYQs और shorter subjects से थोड़ी थोड़ी देर के लिए you just start building your studying habit again, and for this will be helpful for the newer ones and for the freshers also. And regarding new information, we have that we are going to start. We have started online and offline batches also, so you can come and join. ठीक है guys. Now, so just a minute, we need I think there's a technical glitch. ठीक है, give me a few minutes. What other subjects do you guys want to be revised? Tell us. एक बार भैया pause. वो एक airdrop is not working actually. Just give.
तो मिररिंग, हाँ मिररिंग पहले बंद करनी, पहले मिररिंग बंद करना पीयर.
Done. Hello guys, are you back? Hello guys, are you back? Hello Dr. Om Prakash, good evening. So now coming to some of the questions, surgery radio mix or radio you will be dealing now. So today 2 short subjects we have decided, and after that we will be proceeding with other subjects. So identify the image given below. So can you tell me 3 air bubbles were given, 1, 2 and 3. So what can you be your predicted answer? Tell me very matlab one line straight kind of question. It should be triple bubble sign. It's jejunal atresia. ठीक है, remember triple bubble sign. ठीक है guys. Yes. Now tell me this. See, this question was GA68 PSMA scan is used to diagnose which of the following conditions. See, this is a not very normal kind of question. Generally, they don't ask you this, matlab, this kind of questions. So I told you already while taking offline and online classes, for this kind of questions, you need not panic because there will be certain questions which will be common, a little bit uncommon. So either try to attempt by common sense or just if you know, very good. If you don't know, just try to attempt them by common sense and don't panic. So just look at the question here. PSMA. Can you remember something related to prostate? PSA. याद आ रहा है? Something related to PSA, prostate. You read something about the PSA, prostate specific antigen and all. ठीक, तो you can approach this question in that manner, applying common sense. First, I'm telling you how to approach this kind of questions. If you have not studied, so how to approach this kind of question with common sense. तो PSA कुछ याद आएगा, prostate specific antigen, तो you can tell हाँ this is related to something prostate. So then you can take prostate cancer regarding common sense. Otherwise, for detail, I will tell you what is it. PSMA, it is prostate specific. ठीक है, membranous antigen. This is it is simple, prostate specific membranous antigen. Prostate specific membranous antigen it is. ठीक है, so this will be your answer. Now coming to the next question, what was it? This was a common and simple question. You guys have studied this. Make diagnosis based on the given X-ray: lung cancer, miliary TB, ARDS, or Aspergilloma. See, you can see dot small millet like appearance, ठीक है, over the complete lung. This is a very specific, ठीक है, very specific, very common repeat kind of question. Simple answer. It was miliary tuberculosis, है ना. जनरली क्या होगा, लंग कैंसर, या फिर इट इज नॉट कैनन बॉल, समटाइम्स कैनन बॉल. Cannon ball, what happens? Metastasis cannon ball. Big. In generally metastasis, what happens? There is cannon ball appearance. So big appearance they will show you in the lungs. ठीक है, in miliary this will be dot like. ठीक है guys. So Shubham Ghai, are you clear? It's not cancer metastasis. It's miliary TB. Done. Fine. Now make your diagnosis based on the given X-ray. Very simple questions were this time. बहुत ज़्यादा explain करने की आवश्यकता ही नहीं, no need to explain very much. Now make diagnosis based on given X-ray: hollow viscous perforation, pneumoperitoneum, ठीक है, SB और esophageal perforation. Regarding the options, how can you tell? ठीक है, it's just pneumoperitoneum or hollow viscous perforation. How? See, look at the X-ray. यहाँ पर what can you see on the left side? Tell me. Here is a level of gas present. ठीक है, what is it? It is the gas present in the fundus of the stomach. ठीक है, diaphragm के नीचे sometimes on the left side the gas present is normal. It is the fundic gas present in the fundus of the stomach. But on the right side, ठीक है, generally you don't see presence of gas. ठीक है, whenever there is presence of gas on the right side, this indicates there is perforation of the hollow viscous or pneumoperitoneum is there. ठीक है, that means there is air in the peritoneum or peritoneal cavity. ठीक है, done. So regarding the X-ray, you can just check it is pneumoperitoneum. Coming to the next question, tell me. Acha, one more thing, can you guys tell me? What about esophageal perforation? What should have happened if there was perforation in the esophagus? Tell me. There should have been, tell me. There should have been pneumomediastinum. ठीक है, तो the air will be present in the mediastinal cavity. ठीक है, तो it should cause pneumomediastinum. ठीक है, done. pneumomediastinum done. चलो, yes. Shubham bhai, please attempt this question. Make diagnosis based on the given X-ray. It should be. What was this question? Please tell me. It was Aspergilloma. How Aspergilloma? Can you tell me? Why? Because in the question some people were telling that history of TB was also given, है ना? And what happens here? You can see in Aspergilloma there is air crescent monod. ठीक है, you can see here fluid filled. एक मिनट, not fluid filled, but yes. So this is air crescent monod. You can see here. ठीक है, and what will happen? चलो, so just see here. You can see in this already air crescent monod was given. Black is the air part and white is the, ठीक है, so it should be Aspergilloma. Done with the questions of radio. Yes, it is Aspergilloma, Shubham Gai. You can identify here the air crescent monad. ऊपर you can upward air is there. ठीक है, the crescent sign and the sign. ठीक है, done. So questions were very simple, very simple. Repeated hit topics, repeated hit images was given. As you can see from these two subjects, very short subjects we have done just to generate interest among you guys. And other subjects, patho and other, you guys are telling to discuss. Yes, we will be discussing every subject, micro, biochem, getting the time. So our main point is not here the question recall and the discussion. Our main point was to just give you an overview ki ha questions were very much repeated. Now, and also our main point is to focus on the roadmap and how to prepare for December exams. So I think we guys had a lot of discussion, and we hope that you guys will get a good score and good marks. Fine, this was a short session just to generate your interest back into studying. Now, ठीक है, fine. See, in jejunal atresia, you can get triple bubble sign, right? Triple bubble and double bubble sign you get in duodenal atresia. They are classical X-rays. You will be just looking at them and fine. So no need to worry. You are talking about and multiple. Tell me, multiple bubble sign कहाँ दिखेगा? Multiple air bubble sign. First, tell me that. Dr. Shubham, please. Yeah, we actually have ended the session. Now we are relaxing and we are discussing some extra points. If you want, we will discuss for sure, no problem. So what is happening, Dr. Shubham? Tell me. In annular pancreas, what is happening? The pancreas is present in an annular manner. ठीक है? Two bubbles you will be seeing. ठीक है? Two bubble like appearance. The one is the D and the S appearance. Generally, and in jejunal atresia, what will happen? Triple bubble sign will be appearing. ठीक है? I will show you like with this image. Let me show you here. So you will be understanding in a better manner. I'll show you through this image. Yes, Shubham Gai, triple bubble you already told. Just look, Dr. Shubham, for your doubt clearance. Can you look here in the annular pancreas sign X-ray? Fine. And jejunal atresia is very different. Clear cut triple bubble sign you can see. We have shown you in the notes here. See, clear cut triple bubble sign is present. So I don't know how are you getting confused. Are you clear right? Are you clear now, Dr. Shubham? Multiple bubble sign कहाँ दिखेगा? Tell me. Double bubble sign कहाँ दिखेगा, Dr. Shubham? Now please try to answer. Repeat questions है. Can you answer? Hit topics. We will revise them also. See what is happening. In annular pancreas also you get double bubble sign. ठीक है? But and in duodenal atresia also you get double bubble sign. Both of them, what is happening in annular pancreas also can lead to duodenal atresia. What is happening in duodenal atresia? Beyond the duodenum there is blockage. ठीक है ना? Duodenum के नीचे beyond there is blockage, so there will be dilatation of the stomach and dilatation of the duodenum. Correct, Dr. Shubham? तो होगा क्या? Whenever there is blockage beyond the duodenal, and in annular pancreas, actually what is the pathology? Pancreas generally should be present like this. Here is the stomach, है ना? Anatomy समझो पहले. Duodenum and the pancreas should be present like this. But anatomically, in some people, in variation, pancreas is not present like this, but actually it is surrounding here the duodenum. ठीक है? And due to this, it can compress the duodenum. है ना? It can compress. So this will also lead to duodenal atresia only. अगर annular pancreas is compressing the duodenum, it will lead to duodenal duodenal atresia ultimately. So there again there will be double bubble sign, just like duodenal atresia. Understood, Dr. Shubham? So duodenal atresia actually will be caused by, so one of the causes for duodenal atresia can be annular pancreas. Understood? Annular pancreas does not show any double bubble sign. Are you clear? Did you understand the concept? Guys, I hope you understood. Yes, okay. Oh, you are saying thank you. No, it's okay, fine. It's my duty to explain. If you have any doubt, any queries, we discussed, and extra if you want to ask, yes, of course. And I'm here for explaining only. So it's good and it's great if you are. Okay, there was a little bit of confusion first you asked. Chalo. Good, Dr. Shubham, you are trying at least. So this is a good thing. But never get confused between triple vowel sign and annular pancreas or duodenal atresia. It is not like that. Double vowel sign is for generally duodenal atresia. Triple vowel is for jejunal atresia. पहली बात ये क्लियर रखो. दूसरी बात, try to understand. पैंक्रियास कभी भी कैसे तुम्हें बॉबल में एयर दिखा सकता है? कभी नहीं, है ना? तो डुओडेनम या बॉबल में एयर या क्यों दिख रहा है? बिकॉज ड्यू टू डायलिटेशन. वो कब हो सकता है? तो इफ पैंक्रियाज इज कंप्रेसिंग और द आउटलेट ऑफ द डुओडेनल कैविटी, डुओडेनम को के आउटलेट को कंप्रेस करेगा तभी. तो एनुलर पैंक्रियास कैन बी कॉज फॉर दैट. ठीक है, डन, अंडरस्टूड. चलो, नाउ वी आर एंडिंग दिस सेशन. रेडियो ऑर्थो वी रिवाइज how to study, we have, and now we are starting online classes and offline classes also for at NLC for FMG students. So our pattern of classes will be like this, that there will be faculties, all standard faculties in online and offline batches also, they will be coming, they will be taking classes. We have Ashish sir for physio and medicine and other reputed faculties for online as well as offline classes. Printed workbooks will be given, and after every class or every after every finishing of every subject, there will be revision sessions. ठीक है, and PYQs and PYT sessions, previously asked topic sessions and revision sessions taken by me. And after, once the syllabus is finished, there will be again another round of questions or T&D sessions taken by the faculties itself regarding the faculties who will be teaching you subjects. ठीक है, but senior faculties in offline and online mode also. So multiple revision round of revisions will be taken, as was taken by us and team NLC this time and in December also. And we are the only institute who will offer you multiple revisions until the last moment. ठीक है, we took the offline classes and online classes, both we are going until this time until the 4th and 5th of July. ठीक है, we were taking classes on all the best sessions, as you guys already know, on YouTube, online, everywhere. So if you want, you can join our institute, and I'll just invite you guys to join our institute and prepare with us, and we will be very much grateful to be part of your success journey. So please, just ending the session. Okay, कोई बात नहीं, Dr. Shubham Gai, you are telling I am just graduated few days back, struggling with the study plan. I understand. Seniors are there for helping. Consider me your senior as well, and I just offer you to join our institute. And even if you don't, but yes, we are here for helping only, being a senior, being a member of the doctor fraternity. So of course, chalo, bye, good night guys. ठीक है भैया, एंड कर दीजिए.